We'll begin the briefing with remarks from Governor Tony Evers.
Good afternoon and welcome back. Thanks for joining us today. I know so many of you throughout this pandemic have been doing your part to flatten the curve and help keep our families and our neighbors and our communities safe by staying safer at home, limiting social interaction and travel, and wearing face coverings whenever you go out in public. So I want to thank you, as always, for all the work you've been doing and the sacrifices you're making and your commitment to doing everything you can so that we can get through this pandemic together. A few months ago, Wisconsin was in pretty good shape. The numbers were improving, and we had made real progress in fighting this virus. Unfortunately, things have changed drastically since then. The tide has turned, and we've seen a surge in new cases across our state. Although we're fighting the same pandemic, we find ourselves in a completely different situation than one we were in just a few months ago. Local public health departments and workers have been doing their best to respond to this pandemic in our communities, and they've all been doing a hell of a job. But what we know to be true is that this virus doesn't care about any town, city, or county boundary. It doesn't care whether you live in the Dodge County or Fond du Lac County side of Waupun. It doesn't care whether you're perfectly healthy or young, and it doesn't care whether you're a Republican or Democrat. I know there have been those who've demanded a piecemeal rather than a statewide approach. They've said we do not need a statewide effort to respond to this crisis. Well, we tried their way. Folks, it's not working. Our statewide efforts to combat this virus have worked before, and so that's what we announced here today. So today, I declared a new statewide public health emergency as we battled a new surge of COVID-19 across our state. I also announced a new face covering order that will go into effect on August 1st at 12:01 a.m. Give folks enough time to get face coverings if they don't already have them. Although we're facing new and different circumstances than we were a few months ago, the one thing that hasn't changed since then is what I've said all along. We're going to listen to the science and public health experts to guide our decision making. And folks, the science and public health experts are telling us that face coverings and masks can save lives. Your mask protects me, and our masks work best when we both wear them together. Under the order I signed today, face coverings will be required for every person age 5 and older anytime you are indoors or in an enclosed area and you're not in a private residence. That means you can still go for a walk outside, go swimming, or eat without a face covering on. But if you're going to head to the grocery store or you're supporting a local restaurant and waiting for your food, we need you to mask up, folks. And if you are at a private residence but you're with a small group of people, we'd still encourage you to wear a face covering. We cannot allow this virus to go unchecked, and we have to take steps quickly to flatten the curve, slow the spread. We have to get back on track to make sure this virus doesn't cause any more setbacks to our economy than it already has. The sooner we get back to working together to flatten the curve and prevent the spread of COVID-19, the sooner we can get back to work, school, sports, shopping, restaurants, and doing all the things I know we all miss, as soon as we can do them safely. I know folks are worried that the order I'm issuing today keep people healthy and safe will immediately be challenged by Republicans in the court. I know folks are worried another ruling could just create more chaos as we respond to this pandemic. I'm worried about that too. But my job as governor is to put people first, to do what's best for the people of our state, and to do everything I can to keep people healthy and safe. So that's what we're going to do. Please continue to look out, stick to our Wisconsin values of kindness, respect, and empathy, and understand that the most powerful thing you can do is to serve as an example to those around you by wearing a face covering, practicing physical distancing, and following best safety practices. While I know emotions are high when it comes to wearing face coverings in public, I want to remind everyone that we are in a battle against this virus. not against each other. Public health is a team sport, and it is on all of us together to ensure that these efforts are successful. Stay home as much as you're able. Wear your face covering in accordance with the order. And remember that a face covering is not a substitute for physical distancing, so keep 6 feet away from others. Let's mask up, Wisconsin, and let's work together to get our state back on track. And now I'll turn things over to Secretary-Designee Andrea Palm. Andrea?
Thanks, Governor. Throughout this pandemic, we at DHS have committed ourselves to protecting the health and safety of Wisconsinites. As the situation on the ground has changed, and as we have learned more about the science of COVID-19, we have shared that information, our data, and our guidance. Today, we continue that commitment. And here's what we know. We know that Wisconsin is seeing significant community spread. In fact, our data on the activity level of COVID-19 in counties and regions across the state shows us that Wisconsin is in a much more serious situation today than we were a month ago, or even when the governor declared a public health emergency in March. We can use our county-level data to illustrate how widespread COVID-19 is here in Wisconsin. And what that data tells us is that the majority of Wisconsin counties are at a high activity level. 61 of our 72 counties are at a high activity level. Only 2 counties are reporting a low level of COVID-19. And only 3 counties indicate a shrinking trajectory or decrease in their cases, and all 3 of those counties are starting from a high activity level. It's important to understand the community spread is and how the science translates on a personal level. So what do we mean by community spread? We mean COVID-19 is widespread enough that interacting in the community may be all that it takes to expose you to the virus. Remember, people can spread COVID-19 without showing symptoms, which means any contact can put you at risk for infection. On the flip side, if you are infected, it's very possible you are contagious before experiencing symptoms. So if you interact with people in your community, you could contribute to the spread. And again, remember that the science tells us that you can be contagious without ever developing symptoms at all. So all this means that the likelihood of people transmitting and catching COVID-19 in the community is high unless everyone takes precautions together. Between the data showing Wisconsin's community spread and the science informing us that people can spread COVID-19 without even knowing it, we need to take every action possible to protect ourselves and our communities. And this is where the science and the governor's actions today intersect. We know that COVID-19 is a respiratory virus, which means that it spreads through respiratory droplets that travel in the air. The droplets can pass from one person to another when someone coughs or sneezes, or even when someone talks or raises their voice. This air travel is why we talk about the importance of physical distancing, staying at least 6 feet apart from each other. These droplets are also why face coverings and masks are so important. They form a barrier to prevent these droplets from traveling from an infected person to another person. To be clear, face coverings protect the people the wearer interacts with more than the wearer themselves. But by protecting others, you are protecting your community and by extension, yourself. Face coverings don't replace physical distancing or washing your hands, but recent scientific studies show us that they are an important tool alongside these and that they are effective in preventing transmission of the virus. So let's take a minute to update the numbers. As of today, we have added 16,211 people to our total negative count. We have 52,108 total positive cases here in the state of Wisconsin, which is an increase of 1,059 people. We've reached 919 total deaths of Wisconsinites. This increase in cases, the number of people getting COVID-19 in Wisconsin is going in the wrong direction, and we need to take every action possible to protect our communities and prevent additional infections and deaths. Thank you for doing your part.
Thank you. Now we'll open it up to questions, and a reminder to maintain audio quality, to keep your phones on mute until it's time to ask your question. And in the interest of time, please only one question per reporter per outlet. And we'll begin today with Sean Kirkby from Wisconsin Health News. Sean?
Hi. Thanks for taking this call. To the person who's asking for the reporter's names, it's a little bit hard to hear, but for the question I have was, do you guys plan to reissue any of the emergency orders that were affecting licensure evictions that were provided under the first emergency order under the new order? Thank you.
I can answer that. This is Ryan Nelson-Stewart. I think we'll take a look at that. That said, a number of the steps that were taken, this public health emergency is to deal with the situation we have right now, and we're in a very different situation than we were before. And so we'll be taking a look at what measures are needed to address this most recent spike, and that may mean taking a look at some licensure provisions. That said, right now we are really focused on making sure that people are wearing face coverings and that they're doing the right thing to protect themselves, their families, and their communities.
Thank you, Sean. Now to Mitchell Schmidt from the Wisconsin State Journal. Mitchell? Again, Mitchell.
Yeah, I'm sorry.
Go ahead.
Did you call for Mitchell?
Yes, I did.
I can't hear who they're calling for.
Yeah, all right. Thank you very much. Yeah, this is Mitch. You kind of touched on this, but I'm just curious. You'd mentioned, in the past that the Supreme Court ruling kind of hamstrung your ability to pass an order like this. I'm just curious if someone might be able to speak a little bit to the legality of this order moving forward, and then piggybacking off that, why was a mask mandate made today as opposed to, per se, weeks ago? Thank you.
Sure. This is Ryan Nelson-Stewart again. So the Supreme Court decision definitely made things more difficult to address the beginning, kind of the first stage of the pandemic. We were able to use a fairly wide variety of tools in order to address it, especially mostly focused on the powers that the Department of Health Services have. With this second emergency order, it's dealing with it's a very different situation. And to answer the second part of your question, Mitchell, the reason why it was issued now is because of where the numbers are at. I think it's also, there was a increase in the number of cases and the average number of cases throughout the month. In addition to that, it's also, there's been input and reporting from the federal government in terms of urging states like Wisconsin who are in similar situations to take more aggressive action. So we're in a very different situation than we were before. And in terms of the legality of it, that, when the governor declares a public health emergency, he also has authority to issue orders necessary to protect personal security. And that's a face covering requirement does just that. It protects people in order to make sure that they're not transmitting a very deadly virus from one person to the other.
Thank you, Mitchell. Now to Scott Bauer from the Associated Press. Scott?
Hi, thanks for doing this call. Governor, you had been mentioning for weeks this spike that's been going on for well over a month. And to piggyback on Mitch's question, given that your order takes effect on the same day that Jill Karofsky takes her seat on the Supreme Court, are those two things related in any way? And what do you say to people who would argue that that has everything to do with the timing of this order?
Well, it doesn't have everything to do with it. The virus is the issue. It's not Jill Karofsky. As Ryan just talked about, we've been thinking about this for several weeks. Putting together two orders is not something that happens in 24 hours. And so we've been thinking about it. We've been following the data, and we believe that and we looked at different ways of approaching this, and we believe the way we approach this has good legal standing. funding, and also it just makes sense. Bottom line is we need to keep people safe, and this is one way to do it. And we're hopeful that the Supreme Court agrees to this. You never know; it might not even end up in the Supreme Court. People might say, "Okay, we got 60 days to get this turned around, get things safer in the state of Wisconsin, increase our ability to have a good economy, and increase the ability for our kids to get back to school."
Thank you, Scott. Now to Victor Jacobo from CBS 58 in Milwaukee. Victor?
Hi, good afternoon. Thank you again for taking this call. I'm wondering, as this goes into September, and it's difficult to see what the situation will be like when we reach that point, but it will still be, as the school year is beginning and kind of getting into full swing. I'm wondering what would be the plan, assuming this kind of stays in place, if there are thoughts of extend the order or work with municipalities to kind of basically get that through the end of the school year, or keep it longer, or if there are thoughts to work with the school within DPI to keep it mandatory within schools.
Great question, Victor. First of all, I think the school districts are doing a good job at analyzing what they see as it relates to their ability to hold classes in person, and so I've been pleased with the conversations that are happening. I mean, there are schools in the smaller school districts in the state that they begin the year with 15 to 1 class size or smaller, and so keeping that physical distancing is going to be easier for them. But in order for us to kind of equalize opportunities here in the state, we need to get at this virus, and that's why we're doing this order. And I'll let Ryan just briefly talk about what happens after 60 days.
Sure. I think that it's a little bit premature to answer that question. We have to see what happens. As the governor has said, we've been keeping a very close eye in terms of where the virus is headed, and this is a very fact-specific determination. And so I think right now the focus is on making sure that we start to bend the curve here. If you look at the rates over July, they have drastically increased, and so to the governor's point, in order to be able to make sure we can reopen schools and have kids be safe, it's really important that we focus on over these next 30 days in order to make sure that we're in a better place as a state in containing the spread of the virus.
Thank you, Victor. Now to Nick Bohr from WISN in Milwaukee. Nick?
Hello. Thank you for taking this call. So I guess the big questions I have relate to how will the order be enforced, and let's say, for example, that that some people decide they would rather pay than actually wear the mask. What happens I understand there's a $200 fine, but could you go into a little bit more details about the specifics of, again, how that's being enforced, and what would happen in that particular fringe case?
Sure. So again, this is Ryan Elsastuin. So under 323.28 of the Wisconsin statutes, as you mentioned, there is a civil forfeiture for violating an emergency order, and state law gives district attorneys authority to prosecute civil forfeitures. So if somebody makes a referral over to the district attorney's office, they would be able to make a decision on whether or not to prosecute it. I think, though, the thing is as we've said before, is we're really counting on people to make the right decision here. As the governor mentioned, that this has become, unfortunately, a highly polarized topic, but, wearing a mask, it's not a hard thing to do when you're in public. I think one of the goals we did with this order is making sure that it was narrowly tailored. When you're at your private residence or at a private residence, it doesn't apply. It doesn't apply when you're outside, but when you're out and about in public, indoors or in enclosed spaces, it does apply. And, taking a very simple action like wearing a mask has a really significant significant impact on cutting down the spread of COVID-19. So we're hoping that people make the right decision, that when there are situations where people aren't complying, that local officials try to educate first before going down the enforcement route, because again, it's a really simple thing that we can all do in order to reduce the spread of COVID-19.
Thank you, Nick. Now to Will Cushman from WISCTV. Will?
Good afternoon. I was also interested in enforcement, but I'm also curious about what DHS is considering in terms of just trying to get more Wisconsinites to voluntarily take up the use of face masks in public without necessarily having to go down the enforcement road.
I'll just jump in quickly, and then I'll let Andrea take a crack at it. This is Governor Evers. We have been trying to do that significantly. We come here every week or almost every week talking about the very similar things, wear a mask, stay 6 feet apart, making sure that you don't hang out in a small space with a whole bunch of other people without a mask. It isn't rocket science, and we'll continue to talk about that. In addition, we've had a public service campaign all across the state with famous Wisconsinites talking about the importance of masking up. In addition, WEDC, the Wisconsin Economic Development Corporation, has worked with to provide some really needed revenue for our small businesses in the state. And as a result of taking that those resources that they desperately need, those small businesses are agreeing to making sure that their workplaces and their stores are safe and people are doing the right thing. So we have done a lot of those things already, clearly not enough. We will continue to do those things and talk about it. And
Patrick Marley from the Milwaukee Journal-Sentinel.
Ask you, follow.
Go ahead.
Can you hear me? Yeah, sorry about that delay. Governor, I wanted to follow up on Scott's question regarding the timing of this. You mentioned it takes a while to do this, but we've had high levels of COVID coming back for some weeks now. Why do this now rather than earlier? And given that Karofsky's coming on the court here, do you feel that you have a better shot if this does get challenged in court?
Certainly, we believe the court will help us, guide us in decision making, and they have in the past, and I'm sure they will in the future. But and this goes back to the other comments I just made, is that we were really working hard to do this on a voluntary basis. Once we saw that it was important to have masks in place, and we were doing everything possible to get that impetus and people doing it voluntarily, and we spent a lot of time making public service announcements and had recognizable Wisconsinites making the pitch, and with WEDC and their work to help businesses, but at the same time help them also understand how to keep their small businesses safe. We want to allow that to work, and that did to some extent, but clearly over the last couple of weeks it has spiked, and at that point when it was spiking, we decided that we needed to take a more serious look at a requirement, and we came to the conclusion that this is the time to do it. We believe with the way the order has been crafted that it would meet some of the concerns that the Supreme Court has had in the past.
Also, just to add on, I know it's easy to fall into kind of the, thinking that the court is just a political body. But, even looking at some of the losses that we've had, I think you run a risk of just assuming that certain justices are going to vote certain ways. And we saw that with the lame duck lawsuit, where Justice Kelly was the one who authored the opinion knocking down the guidance document requirements. You saw that with Justice Hagedorn's dissent in the Wisconsin Legislature v. Palm decision. So I think while I think it's a tempting thing to think that certain justices are automatically going to line up in certain ways, we want to make sure that we're doing the best thing possible, the right thing based on the law, based on the facts, and we hope that the justices agree with us regardless of what their perceived inclinations may be.
Thank you, Patrick. Now to Rob Sussman from WKOW Radio. Rob?
Yes, thanks for taking my call. There's been some concern among Republican lawmakers in regards to a backlog of negative tests, and I suppose this question is for the Secretary as well as Dr. Prestegaard. What do you say to people like, for example, Majority Leader Jim Steineke, who are concerned that there is a lack of reliable and clear information in regards to COVID-19 testing in the state of Wisconsin?
I appreciate the question. I think this speaks to a couple of things. One, as we have seen a surge in cases here in Wisconsin, we have seen a demand for testing, which makes perfect and logical sense when you're seeing an increase in the number of positive cases, that additional people would experience symptoms or otherwise need to be tested. And so the result of that is that our local public health departments have seen certainly a large increase in their workload as they are doing the work that they need to do to chase the virus, to contact positive cases, to do the contact tracing, to get to those contacts, to do the kind of guidance around isolation and quarantine, et cetera, that is necessary to really reduce the spread and box in the virus. And as that workload has really increased over the month of July, we certainly have seen, as you mentioned, a backlog in entering those, cleaning the data and getting those negative cases into the system. That has not impacted the notification of those negative cases. Everybody who gets a test, their results are returned to them promptly, but they have understandably prioritized those positive cases from a workload perspective so that we are doing what we need to do to focus on the pandemic and the spread in our communities. So I think we certainly have a number of very transparent metrics on the website that speak to the increase in cases, the increase in severity, the increase in spread of this disease that present a robust picture of the way that we have changed course, the way that the month of July has gone in a very different direction than we were seeing earlier in the spring.
I could add one piece to that to add some additional context, is that the standard that we as a state health department and a lot of our county local partners have of sharing data at this level, meaning individual case counts on a daily basis, is truly without precedent at any level of public health. From CDC, from doing national data, to all the other reportable conditions, we typically update those on a monthly or typically an annual basis, because it takes a long time to clean the data, to make sure they're telling us that we're not, to make sure that there's not a lag that comes to these problems. So it was a massive effort, because this is such a historical pressing public health crisis that everyone wants to know as much as possible, that we've adopted this standard of sharing data on a daily basis, which is really unlike anything else we do in public health. And I think we've been pretty consistent on how we recommend interpreting the data when asked previously in this forum, is that it tells a much more consistent and valid story to look at the data data sort of week to week rather than day to day, because we see fluctuations up to date, because that's the time between results going from the lab, with specimens to the lab result back to the computer system out to the dashboard. All those things take time. So I think that the message is the same, that we need to look at big trends, and I think we really need to applaud our data scientists and everybody in that pipeline that is trying to inform the public in as real time and with as much detail and nuance as possible. It's a really impossible task, and I think there's a lot of people working really hard. So I think the caveat that we need to look more at trends rather than day-to-day fluctuations is an important one, and I hope that adds some context to the issue of the day-to-day variation.
Thank you, Rob. Now to Gabriella Rusk from NBC 15. Gabriella?
Hello, this is Lee Mills filling in for Gabriella, and I apologize for jumping on this call a little bit late. So if this has already been addressed, I'll go back and log that later. But if not, Governor, I just wanted to find out if you have reached out to Republican leaders, if you spoke with Voss or Fitzgerald prior to putting out this order, and if so, were you able to come to an agreement about what a statewide requirement might look like ahead of time?
I did make this decision on my own. It's an executive order from the governor of the state of Wisconsin. That said, my staff meets regularly with the staff of both leaders. I know this discussion has been made without any kind of fruition as to what it should look like. I did call both leaders before I made this announcement, and to give them a heads up.
Thank you, Lee. Now to Madeline Anderson from Fox 6 in Milwaukee. Madeline?
Hi, I was wondering, and I apologize too if this has already been addressed, but if you could talk a little bit more about the specific criteria you will be looking at when you decide at the end of September if this order was effective or if it needs to be extended. So, for example, rather than just saying the curve has been flattened, is there a specific percentage of positive cases that you want below a certain number when you're going to make that decision?
Brian may also want to weigh in on this, but I would say, right, our weekly activity level metrics of, that overlay the case trajectory with the prevalence per 100,000 folks is a really important a way for people to think about how how the surge is progressing, whether it's going in the right direction, how it is impacting each community relative to the number of people in their community, and it gives a really important snapshot on over the course of time about whether we are going in the right or the wrong direction. And it helped inform certainly this decision, and I think it is an important thing for folks to continue to be looking at as we move through the rest of the summer into the fall. I think the other things as we have talked about before, that are important things to be thinking and looking at are things like our public health capacity. Are we mitigating the spread of the disease in a way and to a point that we can handle that workload, that we understand that where that positive case was infected, so that we can chase those contacts, box this in, stop the spread. When you're in a situation of community spread like we are right now, it becomes increasingly difficult to find the root of the infection, of who gave it to who in the first place, and that makes it really hard to stop the spread for our local public health departments. And so those kinds of indicators will really help us know when we have reversed these trends that we are seeing now, and we will be back in a place where we are well positioned to do the daily hand-to-hand combat that needs to be done to really wrap around the virus and keep the spread as low as possible.
Okay, thank you, Madeline. Now to Steve Prestegaard from the Platteville Journal. Steve?
Thanks for taking my question, which is, I guess, a follow-up to the couple of questions about enforcement. Given the fact that the safer home orders, you had local, I think several sheriffs who said they were not going to enforce them. You had a number of people who kind of flaunted the orders in the first case, and you also have people who have been questioning the truth of the numbers, given the fact that there's been some issues with certain county counts. I guess, and this is a question for the governor, by the way, I guess I'm still wondering why you feel people who have been suspicious about what the state has done will actually go ahead and follow this order.
Because it's the right thing to do. I would say that it's quite that simple. The science shows that wearing a mask will help stop the transmission of this disease. Do I think that there are going to be people that flaunt it? You bet. Do I think that there are some sheriffs that will become constitutional experts on this and say, we don't want to do this? Yes. But as governor of the state of Wisconsin, and frankly, the vast majority of people of the state of Wisconsin that have been asked about these things, is that masks do matter, and it's the right thing to do. And so we expect compliance. During the Safer at Home order, there were people that flaunted that, and there were sheriffs that said we're not going to enforce that. But it made a difference. It saved lives. And it also helped us reduce or slow down the spread of the disease until the Supreme Court decided that they knew better and made the changes that they made. So, yes, I understand that there's going to be a handful of people in the state, a small number of people in the state that will buck this order, but it's the right thing to do, and I'm sorry to put it so simply, but we need to do it for each other, and if we don't, we'll pay a huge price.
Thank you, Steve. Now to Rachel from TMJ4. Rachel?
Tom Duran here, in for Rachel. A question for the governor. Senator Steve Nass has already put out a press release saying that he wants to hold a special session to talk about the mask mandate, calling it illegal and unconstitutional and a power grab. I wonder if the governor would welcome legislative input on this issue.
Well, hell yes. The Republicans could have came into session at any time. This has been a long pandemic, folks. And you look around states in the nation, we are one of the few states where the legislature has not taken an active role, hands off. So suddenly Steve Nass gets excited about this and wants to bring people in to do away with his order. I think that's a sad commentary for all of us. Obviously, he doesn't believe that masks matter, and that's fine. He can be one of those people that flaunt the order. But to come in and have the Republicans essentially say we don't believe in science, pretty risky business. Pretty risky political business and real risky health business.
Thank you, Tom. Now to Jeremy Janine from Urban Milwaukee. Jeremy?
Question about the number of active hospitalizations. We're over a week into an issue with at the Department of Health Services reporting a bouncing number and the Wisconsin Hospital Association reporting no number. When will that issue be resolved and what's happening there?
Yeah, thanks for the question. You know, we were, the hospitals were given very little notice on some new reporting requirements to the federal government, which required them to start reporting into the system, answering the questions and data fields for the federal system, while we had with them worked through a system and through a a technology where they were reporting information to us and to the hospital association, as you mentioned, that was providing information that we were displaying on our website as well. So between the short turnaround, the short fuse on those new requirements at the federal level and the fact that they are two separate systems that need to be entered in the middle of a surge where they're all pretty busy taking care of patients. We have been working with them diligently to smooth out these issues, and we certainly anticipate by next week that we will be in much better shape again. But I think this is an issue of multiple systems with that both need to be entered, and how we, from a technology perspective, smooth that out so that we are reducing workload for everyone as much as possible is certainly what we're working through right now, and are grateful for our continued partnership with the hospitals on this issue.
Thank you, Jeremy. Now to Dan Malloy from Spectrum News. Dan?
Hi, Governor. Appreciate you guys taking these questions today. This is more of a point of clarification. Will every person working indoors at a private business need to be wearing a mask? And if so, how much responsibility do their employers have to make sure people indoors are complying with this? Thanks.
And I'll turn it to Ryan for the specific answer, but I just have to tell you my belief and observation over the months that this has been going on is that the business community has done a pretty good job around this issue, and that many employers already require social distancing and masks. And so I don't think this is going to be a significant burden for them, because many of them already do it.
Sure. Thank you, Governor. In terms of the first question, yeah, the order applies to any time you are out in public and indoors or in an enclosed space. So that does mean, with the exception of private residences. So if you are working in an office, for example, and there's another person in the room, the order does require you to wear a mask. If you're in an office sitting by yourself and no one else is there, then you do not need to wear a mask. In addition, there are some carve-outs for special situations where state or federal laws or regulations would require come into conflict with wearing a mask.
Thank you, Dan. Now to Ryan Curry from NBC 26. Ryan?
Hi, good afternoon. Does the state have any sort of, I guess, backup plan in case this new order follows a similar fate that the Safer at Home order followed?
Well, we'll continue to look at any alternative that we could possibly do in order to stop the spread of this virus. And again, it's pretty simple stuff. Wear a mask, stay 6 feet apart at minimum, making sure that you're doing good hygiene, making sure that if you find yourself in a small room with a whole bunch of people and no one's wearing a mask, you might want to get the hell out of there. There's just some basic things, and so a backup plan is, we're doing it right now. We're saying if you're not wearing a mask now, you should be wearing a mask.
Thank you, Ryan. Now to Kia Murray from WLUK in Green Bay. Kia?
Hi, can you hear me?
Sure.
All right, well, the question I have is for the governor. This order, it does encompass the August 11th election. So will people be kept from voting if they refuse to wear a mask? Should their polling locations be indoors, or will they be fined for trying to vote without a mask?
Brian Elsistu and I can answer that question. No, I mean, people have a constitutional right to vote, and we encourage everybody to wear masks. It's not up to clerks to enforce this order. Clerks' jobs are to make sure that every vote is counted. And I will say that, local clerks around the state have done just an excellent job with going through some difficult situations. With the April election was very difficult. We're going to have the August 11th election where it's going to be a challenge again in terms of making sure that our clerks are supported with having proper supplies and having enough personnel. And so I think this is one of those things, again, why it's a good reason for everybody to wear a mask, is because if there is a line, we want to make sure the person in front of you is kept safe, the person behind you is kept safe. And so this is a very simple way to make it safer for people to vote. And the final thing I will say is I think this is yet another reason why the best, safest, and easiest way to vote, whether it's on August 11th or November 3rd, is to request an absentee ballot and vote by mail.
Thank you, Kia. Now to LaToya Tiffany Whitley from Milwaukee Public Radio. LaToya? Milwaukee Public Radio. Okay, we'll move on then to Brianna Riley from the Cap Times. Brianna.
Yeah, thank you so much for taking my question. Governor Evers, what do you say to people who argue less populated areas of the state should be treated differently?
Well, as I said before, this virus has shown up in every county in the state of Wisconsin. So it's not like if there's a county line there that the virus stops, nor is it stopping people from going to work in a different county or whatever. This surge is a statewide surge. One of the counties where we had very few cases just had, it just exploded with the number of cases that they now have. And so a statewide effort to wear a mask is really important, because the virus does not know boundaries, even though we do a lot of looking at data around different counties, but every county in the state of Wisconsin is impacted by this virus.
Thank you, Brianna. Now to Mason Dowling from WAOW TV in Wausau. Mason? Mason Dowling? And we'll move on then to Laurel White from Wisconsin Public Radio. Laurel?
Yeah, thanks again for doing this. I'm just curious to get a little bit more insight from the governor on some of the pushback to mask mandates that have been around for a while. Some of the comments coming out now are talking about how, in a reflection of that conversation that's been going on, that this is a violation of individual liberties, that people should be able to have the choice to wear a mask or not in public. And some people are even adding that they don't feel safe wearing a mask because they're hearing that it could hurt their health to have a face covering on. So what's your response to that?
Not quite clear on the question, but if you're asking my response to people that don't want to wear it for various reasons, the data is pretty strong around that. In fact, I saw a miraculous change of heart from the President of the United States on this issue. So I think people, once they get a feeling that, an understanding that, you may be frustrated about having to wear a mask. Some people are frustrated about having to obey the speed limit, but they do that too. Or they obey the speed limit even though they're frustrated about that. This is about life and death, and about making sure that we're keeping, even though we may be frustrated by it because we don't have it, or we hate to have to wear a mask and it's an imposition, we're helping save lives. And I think that is an overwhelmingly substantive way to look at it.
Thank you, Laurel. Now to Stephanie Hoff from West Politics. Stephanie.
Can you hear me? I'm sorry. Hello? Okay. Awesome. All right, so my question is for the governor. I'm just wondering what you think of the president suggesting to delay the election. And then also to remind you that at one point you also tried to move an election.
Yeah, that's true, I did. But the November election for the President of the United States, that date is in law. It would need to be changed by Congress. Don't see that happening. And frankly, just bringing it up is breathtaking in and of itself. So I'm doubtful that it would happen. I think the president has gotten pushback on that, and so it's unlikely he'll be talking about that anymore. But at the end of the day, the election will happen on the day that's deemed in state law or in federal law.
Thank you, Stephanie. Now to Martin Roccasoli from WORT Radio. Martin? Martin from WORT. And we'll move on then to Emily Davies from WSAW-TV in Wausau. Emily?
Hi, good afternoon. This question is likely for Ryan Nelson-Stewin. As you guys have all said, there are going to be people that don't want to wear masks. And some of the exceptions that are in the order, I think really almost anyone could probably say it's hard to breathe in a mask at certain times. And obviously there's the medical exemptions for businesses and places that are trying to be understanding of the exemptions for the people who actually need them. But then also wanting to enforce it for the people that maybe don't need them. What rights do they have to ask about those needs and to validate that those needs are actually what they are?
Sure, this is Brian Nelson-Stewin. I think, we've seen this play out already. This isn't anything new for a lot of businesses. We've seen, these mask face covering requirements are in 31 different states, now 32 with Wisconsin, so it's covering the vast majority of the country. We've seen major retailers like Walmart and Target and Costco require them, and I think it's simply, again, kind of as I mentioned before, in terms of compliance and enforcement, is that I think we need to ask people to do the right thing, to wear masks if they do meet one of those exceptions because they have, a health condition or others. That's where it's good to have a conversation and explain it. And, unfortunately, a lot of these, it's not hard to find videos of people taking pretty extreme measures. That's the last thing we want. Instead, it's good to be able to treat people civilly, and if somebody has one of the exceptions, to accept it at face value.
Thank you, Emily. Now to WKOW-TV in Madison. WKOW.
I'm Dan here from WKOW. Governor, you touched on this a little bit earlier, but with kind of the patchwork approach that school districts are taking statewide as far as reopening in the fall, have you considered an order to standardize it, or would you consider an order standardizing school openings across the state if the situation changes?
You never say never in this world, but I have been following decision making in our schools, and I just think they're looking at it appropriately. And yes, it's about making the decisions around the issue of science and how they're going to keep kids safe. And that's the appropriate way of looking at it. So I really don't have any plan to do that and standardize it. I'll just give you a small example. There are school districts where their buildings are very, very old, and the idea that they're going to fit enough room to get class sizes small enough, or wherever you can do social distancing for a larger number of kids in an older building, that's pretty damn tough. And so there's other things that have to be considered that are local, and the type of facilities they have is certainly one that, and then having a standardized approach, at least at this time, doesn't make sense to me.
Thank you, WKOW. Now to WBAY-TV in Green Bay. WBAY. WBAY-TV in Green Bay. Okay, moving on then to WISC TV in Madison. WISC.
Hey guys, can you hear me?
Yes.
This question's for Governor Evers. With your creation of another public health emergency, this allows you to continue the eviction moratorium. I want to know if that's something that you have plans to do, and if so, what's your outlook on that?
That is, we're focusing on getting this order in good shape around the issue of masks, and so that's going to be consuming us for the near future. But we are concerned about the evictions in the state of Wisconsin. That's one of the reasons we've put, I think, $25 million into a rental assistance program that will get money to landowner or the owners of the facilities so that people are not evicted. So we'll continue to focus our eviction work by making sure that rental assistance program continues to do a good job.
Thank you. And our final question this afternoon belongs to Eric Gunn from Wisconsin Examiner. Eric?
Thank you for taking this question. I know that there was earlier a question about hospital data, but I have a somewhat different one, namely how close or far are we from the potential of an overwhelming surge on our health and hospital systems that was certainly a concern early on in this before. What's your sense of where that's, how close we are to something like that happening again?
So Eric, we do certainly stay in close touch with our local hospital systems because they have done a lot of surge planning and figuring out how they would and are converting space to maximize their bed capacity and their ability to serve patients should they need it. So I think overall, I would say that hospitals are busy and are increasingly busy, and we again continue to stay in close touch with them and local public health about the impacts on their capacity and their ability to serve folks without going into what we call crisis standards of care. But Dr. Westergaard, if you want to say anything more specific, I'd welcome that.
I think the point that I'd add is right now, none of our hospitals, to our knowledge, are reporting that they are in a crisis mode, meaning that bed availability, ventilator ability is not at a crisis. I would say anecdotally that nearly 100% of our local public health departments are in a crisis mode, and this came up earlier, and the ability to respond to cases, do contact investigations, notify the contacts and provide the advice, that part is very strapped. And I think the real concern that, although the epidemic is heating up to a phase where it hasn't translated into a large number of critically ill people, our ability to control it at the local level is becoming very threatened and very, very weak. So the biggest immediate benefit of turning the corner right now and trying to flatten the curve urgently is because all the tools we've put in place to break local chains of transmission through contact tracing and case notification are really threatened by the volume. So to the previous question about what does improvement or success look like, right now we need to be able to support our local public health to do the investigation to protect people, because we know that works, that containment strategy. And right now I would say every health officer I've talked to said that they are in a crisis in terms of being overworked and understaffed. So that's something I think we should keep in mind.
Thank you, Eric. And that concludes today's briefing. Please continue to monitor the DHS COVID-19 web pages for data and guidance. Additional information can be found on the websites of the Governor, the Department of Workforce Development, the Department of Public Instruction, and the Department of Children and Families. Be safe and have a good afternoon.